Welcome, everyone. Just letting folks in from the waiting room. Nancy, if you want to share the slides, we could pull those.
Yeah, absolutely. Oh, just take me 1 second here. Just want to do one thing.
I see a lot of MPHA members, some new faces. Welcome, everybody. Folks are still coming in. We'll give them just a moment. Okay, welcome everyone to the second oral health webinar series. Today we will be talking about the medical dental integration, expanding dental partnerships for increased access in Minnesota. And we're going to go through just a couple of Zoom housekeeping reminders. Basically, you can keep your camera on or off. Please use the chat, and please mute yourself if you're not talking. And questions for the chat can be put in at any time. And MPHA's Health Equity Committee developed this ancestral land statement. So I'd like to read that now. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial, and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. And I am so pleased to introduce our facilitator for today, Nicole Ferrian, who's going to lead the rest of the session. Thanks, Nicole.
Yeah, sure. Hi, my name is Nicole Ferrian. I am a dental hygienist and Apple Tree's Clinical Innovations Director. As Mary had mentioned, as we go through the presentation today, if you have any questions, feel free to place them in the chat. There's no need to hold them until the end. I'll just keep track of them, and then we have made time at the end of the presentations to address those and have a Q&A session. So first, what I'll do is introduce you to Nancy Franke Wilson and Dr. Jesse Grantz, and then Nancy will present, followed by Dr. Grantz, and we'll move into a question and answer session. Nancy Franke Wilson has been an independent consultant in the areas of public policy, communications, and organizational development with government and nonprofit organizations for over 20 years. She holds a Master's of Science in Health Science and Public Administration, has served on numerous boards, including the Minnesota Board of Rural Health, Mothers Against Drunk Driving, and has served on the Planning Commission for the City of Plymouth. She is a prolific public speaker and trainer, has been a trainer and facilitator for the United States Department of Transportation's Traffic Safety Institute for several years. Nancy currently serves as the Executive Director of the Minnesota Oral Health Coalition. The Minnesota Oral Health Coalition, also known as MOHC, is a statewide nonprofit organization aimed at supporting the Minnesota State Oral Health Plan and increasing awareness, education, and access for all oral health. The coalition membership is open to all individuals who hold a vision of optimal oral health for all Minnesotans. Dr. Jesse Grantz is a full-time general dentist at Apple Tree Center for Health in Fairmont, Minnesota. He's a graduate of the University of Minnesota School of Dentistry in 2021. He has a passion for working with patients with special needs and a holistic approach to oral health care, especially focusing on managing systemic disease and nutrition to help break cycles of disease. In addition to clinical care, he is part of the Apple Tree Dental Research and Innovations teams, which allow him to be part of the Southern Minnesota Early Childhood Dental Network to give presentations like this today. He is also a part-time student at the University of Massachusetts online program, working towards a master's degree in public health nutrition so that he can help decrease barriers to care through teaching and advocacy. I'd now like to turn it over to Nancy so she can begin her presentation.
Thank you so much, Nicole. And I get to proudly say that I am also a past president of the Minnesota Public Health Association. I like to say that. I'm very proud of that. All right, let's see. I want to start out by saying that the Minnesota Oral Health Coalition is made possible by a grant from the Delta Dental Minnesota Foundation. And when I say it's made possible, it really is made possible. They're not only our funder, they're also great partners. And they're responsible for funding really, really important work in Minnesota. So I'm very proud to be connected to them. A little bit more about the Minnesota Oral Health Coalition. In December, we approved our latest strategic plan and tweaked our mission just a little bit. Our mission is to strengthen Minnesota's oral health community through partners, resources, and outreach. And our vision is optimal oral health for all Minnesotans. In terms of our work with medical dental integration, I wanted to start out by talking about a group that we formed a little bit over a year ago. We called it the Medical Dental Integration Work Group. It was a pretty small group. It consisted of, and it's still in existence. We just don't meet regularly anymore. But it's Dr. Linda Maytan from the Minnesota Department of Human Services, Dr. Helgeson and Deb Jacoby from Apple Tree Dental, Dr. Carl Self from the University of Minnesota Dental School, Dr. Mary Syro from Hennepin Healthcare. She's the dental director there. Dr. Aaron Westfall, who is an OD physician at Mayo Clinic in Mankato, and then Dr. Daniel Rose, who has now left Minnesota, but if any of you know Dr. Rose, he was key in Minnesota for a lot of work, especially oral surgery, and really helped us with access and was a big proponent of access, getting access to more people. Just a few things that the medical dental integration work group looked at or addressed when we were meeting regularly was to develop a dental framework within the friendly adult health system, HPV, looking at pharmacy and pharmacists, having recommendations to the Minnesota State Oral Health Plan in terms of medical dental integration, the Health Information Exchange, which is part of the state of Minnesota. And then we actually put together a framework for medical dental integration for Minnesota. And that's my next slide. I know this is really a lot, and I'm very happy to share this with anyone who has an interest in spending more time with it. I show you this to look at the opportunities that we have rather than to make you go, oh my gosh, this is too much. But our goal was to look at the areas that would need to be addressed for medical dental integration. And some of these, I think, are really clear to us. They'd come to mind really easily, billing and records and things like that. But what I really appreciate about this group is they took it a few more steps, looking at facilities and sustainability and evaluation, for instance, that I think is really important. Health information exchange again. We looked at some other integrations like behavioral health with medical integration, and that was really helpful. But again, I don't share this to discourage you. I share this to encourage you and to possibly have you look at this list and think of what did we leave out? And also, where are there places in this framework where your work could be touched or you could touch this integration, this model? In December of 2022, we held a medical dental integration conference. And the conference was really unusual for us in terms of how we delivered it. It was virtual. We did 3 different mornings over a work week. And I just found that to be a really helpful way. It was only 2 hours each of those mornings. And we found a lot of participation. And I think that really helped people saying, I can get away for 2 hours. And we also, gave people obviously an opportunity to pick and choose what they were going to attend. These are some of the topics that were covered, and really appreciated that we had such a broad range of topics. We also had some speakers, we had a speaker from California, and that's, again, one of the positives about being on Zoom or being on Teams is that we're able to bring in people that might not otherwise be a part of our conference. We will be looking to do this again later in 2024, and hope that we can hear from some of you who want to participate or maybe give a presentation. But what I really appreciated about this conference was it was a nice combination of us reaching out to people we've heard of and say, hey, we've heard you've been doing this. And then other people saying, hey, I heard you're going to do this conference. Can I present? And I just think that's so valuable. I'm never going to know what is going on, what everybody's doing. But I might know some, right? So we want to make sure we can get as much information out there and as many people participating as possible. I said before that we completed a new strategic plan, or an updated strategic plan. It was approved by our board in December of 2023, and so it started this year. And I just wanted to point out that we have 4 goals in our strategic plan, the Minnesota Oral Health Coalition Plan. And goal 4 is actually medical dental integration, or what we call in our plan, whole person integrated care infrastructure. And so I just wanted to show you our 4 objectives and have you take a look at them. One of them that I'm really excited about, well, I'm excited about all of them, of course. I do really appreciate objective 1. And I think this is part of objective 1, is to increase the awareness of oral health as a critical component of public health. So I appreciate that. As you look at these, and this is something we could spend an hour on, and I would love to, but objective 4 for me is really been fun because the state of Colorado has an integrated care medical dental integration toolkit for the state of Colorado. And I'm a big proponent of looking at what other states or other organizations have done, and Minnesota-ize it for us. So we'll be looking at Colorado's toolkit really closely. And Dr. Erin Westphal, who I mentioned was on our medical dental integration work group, she told me about it. And she said, I actually used it a lot as we set up. They have a dental hygienist embedded in their clinic. And she said, I used the Colorado toolkit, and I would sure love that for others if it was Minnesota-ized. So just showing you that of our 4 goals, this is one of them. So it's important. We are also part of Children's Dental Services was awarded a Health and Human Services Administration grant for Southwest Minnesota. And our goal in working with this grant with Children's Dental Services is to increase community health workers in a dental setting. And what we're doing is we are creating some materials. We've created materials, and we're going to start doing some in-person recruitment opportunities where we share with people who maybe are not community health workers already, or perhaps could be right now, and just share with them how much they're needed and the important role that they play in a dental office. And here's just 3 of them: case management, health education, coordination of care, really vital roles that they play. And Children's Dental Services, as a part of this grant, and I think also after the grant is over, will hire and train community health workers to work in their clinics. And I've already talked to some community health workers, and I'm going to do another presentation to them on Wednesday. And it's been really fun. I talked to one and I said, is this something you're interested in? She's not working. She took some time off to raise her kids, and she's ready to go back to work. And she said, oh my gosh, I want to work in a dental setting. And I was like, did someone put you up to this? Like, this is too amazing. And so I already have her talking to Children's Dental Services about it. So it's exciting. And the other thing that's really great about this is the materials that we're developing and have developed through this Health and Human Services grant, then we'll share them with our other clinics in Minnesota. So everybody can benefit from this grant coming to Minnesota. Another thing that the Minnesota Oral Health Coalition has done is our friends, Dr. Colleen Brickle at Normandale Community College. Dr. Brickle was awarded a 5-year HRSA grant where she and her team looked at collaborative dental hygiene practice. And one of the outcomes of their grant was a toolkit, an online toolkit. And I worked on it as well. I was part of her group. We called it the Minnesota's 21st Century Dental Team. And we created this online toolkit. And recently, Normandale Community College went through some leadership changes and changes to their website. And they said, we're no longer going to be a placeholder or be a home for this toolkit. And we were so lucky, thanks to our Delta Dental of Minnesota Foundation grant and we have a 3M grant, that we were able to actually move this toolkit to our website and not lose it. And so it's really special, because during this time that we talked about losing this toolkit potentially, I heard from countless dental hygienists who said, please don't, I always use that website. So I appreciate this opportunity to share this with more people, that it's on the MOHC site. And there are things for others, even if you're not a collaborative dental hygiene practice hygienist. One other thing that we did, it's a public information campaign called Meet Your Mouth. It's part of your body. And this really has to do with how often and how common it is for our health systems and for some people to see the mouth as very separate from the body. And I'm often reminded of something that Sarah Wovcha, the executive director of Children's Dental Services, she told me when I first started. She said, just remember, Nancy, your mouth is less than 3 inches from your brain. And I thought, oh my gosh, so that was one of the things that really got me thinking about this. So we created this public information campaign. It's on our website. Right now we have 15 of these areas. So your mouth and heart disease, your mouth and HPV, your mouth and arthritis. And then we created these one-pagers. So this one is obviously your mouth and vaping. So these one-pagers are they've got a few different facts. You can look at this, you can aim your phone at this code. You can go to our website and learn more about where this information came from. And then we also did a variety of these infographics. We've got 2 to 3 infographics for social media or for newsletters for each of our topics. And we also have all of this information in 5 additional languages, and it's all on our website. And if you want something and you don't see it, please connect with me. Because if you need it, we want to create it. The first Wednesday of every month, we host a medical dental integration community conversation. This Wednesday at noon, it's Dr. Eileen Crespo. She's outstanding. She's done a lot of work with Dr. Jenny Oliphant, who's on this call. And if you want more information about that, let me know. Otherwise, go to the resources page on the Minnesota Oral Health Coalition website for the Zoom. You don't have to sign up. Just go to our resources page and get that link. And real quickly, Dr. Michael Helgeson and I, he's from Apple Tree Dental. He and I were invited to this National Action Framework for Medical Dental Integration Partner Engagement meeting in May. And it was really outstanding. And the reason I share this with you is that I just want everyone to be aware that our partners at the CDC are also really involved in medical dental integration or whole person care. They're actually working on a national campaign and ways that they can support medical dental integration as well. And I think it's really important, especially with MPHA, that we understand that our partners think this is important too. And that's me in December in Key West, just loving life. Thank you so much. And please connect with me if there's anything I can do or anything that you'd like to do with the Minnesota Oral Health Coalition. And Dr. Grantz, you are next.
Absolutely. Thank you so much. Let me just get my screen shared here. All right. Perfect. And everyone can see the presentation okay? Good. All right. So as I was introduced, my name is Dr. Jesse Grantz. I'm perfectly happy with either Jesse or Dr. Grantz, whatever anyone is comfortable with as questions come up towards the end of the presentations. I'm a general dentist down in Fairmont, town of about 10,000 people down here in southern Minnesota, just north of the Iowa border. And we have had some unique opportunities within our clinic to focus on several medical dental integration efforts. So we're going to go into just a few of kind of the previous projects that we've done. I've been working now at Apple Tree Dental in Fairmont for just about 2.5 years. So we've gotten a few things underway during the time that I've been here. So the first thing that I'm going to talk about is kind of the physical integration of Apple Tree Dental. Our clinic in Fairmont is located inside of a Mayo hospital, so that co-location gives us a little bit of unique opportunity, like I said, to kind of participate in that medical dental integration. We're going to talk about a CareQuest grant that we were funded with. Basically, as soon as I started, we were already undergoing this project. So I'll talk a little bit about what we did with that. Things like collaborative events that we've done in the community. And then finally, kind of some visions of future medical dental integration, some of which came from the Transforming Rural and Community Healthcare Conference that Mayo Clinic put on last fall. So yeah, we rent space inside the Mayo Clinic building. We're kind of situated right in the middle of their clinic side, opposite. This is the entrance from their hospital side, so we're sort of well on down the way from there, but we are just nestled right inside their building, which has both opportunities and challenges that brings with it. One of our big goals was to engage in community outreach. So we have built a garage space, and our mobile clinic is located in the same garage with the Mayo Clinic Winnebago that provides their mobile care and outreach. So that is a kind of fun collaborative part where we got to help develop some of the infrastructure around the building with their help. We're not officially affiliated or partnered with the Mayo Clinic at all, and that also brings kind of some opportunities as well as challenges. But we do have a staff member from our staff who attends their monthly meetings for both things like facilities notices, any drills and things that are going on, as well as event planning within the Mayo community. So we've been able to participate in a lot of their sort of staff appreciation events and things like that inside the building, which are just a really nice way that our staff can kind of interact on a more social level with their teams inside the Mayo Clinic. All right, so over the course of fall of 2021 into the following fall and winter of 2022, we had a grant-funded collaboration through the CareQuest Institute for Oral Health. And that kind of started basically right when I came on board in September of 2021. We had already secured the funding, and that's one of the reasons why I was brought on, because of my interest in kind of the academic and holistic elements of dental care on top of just sort of the day-to-day clinical care. So we started by developing a survey for their primary care team. And after we sent that out and received responses, we kind of tried to identify a few areas where collaboration might be needed. So the first thing that we did, based on some of the responses from their care team, was that they really weren't very comfortable with all of the various elements of an oral exam. And those oral exams were something that they did for patients, especially children, at well child checks. So they just wanted kind of more information, more thorough education on what we look for in our oral exams and how they could do better in identifying patients with high needs and other kind of oral health conditions. So that was the first opportunity that I had to collaborate with them, and I presented back in February of 2022. We kind of gave their entire primary care division a presentation on the oral exam from a dental perspective, and how to kind of break things down and in terms of what we're looking for and how they could develop a more thorough framework for their oral exams and their well child visits. And we got very positive feedback about that. There were a lot of people who, even doctors who had been practicing for 20 years, that said that they were very grateful to have that kind of extra dental perspective on what that exam looks like, and all the different elements that we're looking for. And kind of continuing from that presentation, we developed the next stage in a sort of series of meetings, of presentations to them. So we talked about some of the biggest conditions in our community in southern Minnesota, which were diabetes, hypertension, and pregnancy. So things that they deal with on a day-to-day basis with their patients in the primary care division. And things that we see all the time in our dental clinic as well. So we talked about specific oral health impacts of diabetes, hypertension, and pregnancy through that. And it was great in terms of sort of being that extra bridge, that extra step, where when patients are diagnosed with diabetes, they often get referred to a nutritionist and things like that, but they also don't get necessarily the education about oral health side effects of medications, and how changing the diet can impact their oral microbiome and oral health in general. So we were able to kind of give some recommendations, as well as take some feedback and information about what those conversations with patients as they go through each of those conditions look like. And again, sort of offer a handout and some dental perspectives as far as where they could go to improve their care to their patients, and for us to improve our care to ours. And then finally, one of the other things that we were able to do, this was sort of a difficult category without having an official partnership or affiliation with Mayo Clinic, because we had to be very careful in terms of sort of how we communicated and referred these patients. We didn't want to be any kind of an exclusive partner, an exclusive referral source, but we did want to be a resource where we could divert some patients who were going for oral health concerns and who were checking into the emergency room. So we were able to develop sort of a referral resource where if there were immediate oral health conditions when we were open, and even when we weren't open, they would be able to give us as a resource to those patients. And we've been able to kind of minimize those extra hours that their emergency clinicians sometimes had to do to sort of redundantly treat oral health conditions, where a lot of the time all they can really do is give a nerve block or something like that to ease immediate pain, and then prescribe either an antibiotic or a pain medication or both. So instead, we're able to divert some of those cases now, where we can see them in emergencies for extractions or other type of care, and we can help to reduce the impact on their emergency room clinicians. And we also do try to maintain sort of a network for referring back to them. Most of our patients see the Mayo Clinic doctors as their primary care providers anyway. But we developed a little bit more kind of plain language and internal referral communications for things that we might need for proper patient care, like blood pressure management, which is something we run into a lot in dentistry, as well as sort of timing for nurses taking INRs and things like that prior to patients being seen with us. So we just kind of extended a little bit of communication and formalized a couple of things by developing sort of those resources and those connections within our hospital. We were also able to collaborate with them on an outside event, so a community event, where each year they do a sports physical event where they basically drive their Winnebago across the street to the high school. And they do sports physicals that are either discounted or free for the middle school and high schoolers in the area. So we thought it would be a very fitting collaboration to offer customized mouth guards for this community that basically we charged $30 for the mouth guards just to cover our shipping and lab costs. But otherwise, this was something that we offered sort of all the staff time free of charge. And it was a great opportunity to collaborate with them. They had in their clinic for the sports physicals, they saw somewhere between 30 and 40 people, and we fitted about 25 of them with custom mouth guards that they could then use during the fall sports seasons. So it was definitely a good collaborative effort. There were, of course, some stumbling blocks and things that we found that we could work on for the next time. But every kind of opportunity for collaboration and things like this is a learning opportunity. So we were very glad to be able to share the stage with them and take care of two problems that those children might have in one. And then this past October September, at the Transforming Community and Rural Healthcare Conference, I was able to submit a poster presentation on reducing barriers to care. That was kind of one of the big things, the big talking points throughout that entire presentation was on how we can reduce barriers to care for patients, especially in rural settings. So the poster presentation that I submitted was on kind of the development of our pediatric and geriatric outreach programs that we've instituted at our center over the course of the last 2 years. So Fairmont Smiles is our outreach at Fairmont Elementary School, where we visit their clinic and can offer full service dentistry over the course or at their school. So we set up 3 chairs inside their school and are able to kind of reduce that primary barrier to access of having to have parents or guardians bring those students or bring those children to our clinic. So it helps to reduce the need for parents to take time off of work. We're able to do kind of all the coordinating of forms through the school, so we can get things sent home to parents and get them returned, and we have all the proper documentation and consent put in place through the school, and then we're able to do pretty much full service care. There are certainly some children who need to be referred to our clinic or to external pediatric specialists for really deep care, for bigger procedures that need to be done. But we've done plenty of hygiene appointments, as well as fillings, even things like pulpotomies and extractions at their school. So we're able to provide that care for them, and that's been really beneficial to a lot of that community who doesn't have other good means of getting in to see us. And the geriatric outreach that we do is at the Lakeview Methodist Healthcare Center in town, where we have a practice agreement with them, where we see all of their patients for screenings and exams on an annual basis. And we're just coming to the close of the first calendar year that or the first year that we've been doing that. And it's also been very successful. There's a lot of these residents who basically have no other means or motivation for coming to dental appointments, for whether it be for cleanings or even to kind of restore their chewing function with things like denture services. So we've been able to do a lot of good in that community as well. And one of the big hallmarks of the presentation as a whole was the use of digital technology and telehealth in order to have providers and specialists reach patients from further afield, minimize those barriers like transportation cost, and basically find ways to reach people in the most rural of areas, especially as we've found over the course of the last several decades in both medical and dental care. There are a lot more kind of aggregated groups of clinicians. And having small rural practices for both medical care and dental care are becoming a little bit more sparse. So Appletree in general has been working on several ways to implement telehealth technology over the course of the last several years as well. And some of these projects are things that I've gotten to be involved in. So one of the recent ones that we've been implementing is called Overjet, which is a dental imaging artificial intelligence software. And that allows us, basically it's a software that overlays onto radiographs, x-rays that we take. And that shows us basically what the AI's best guess is of where there are areas of bone loss from periodontal disease, gum disease, areas where there is suspect caries or cavities. So we're able to kind of track those numbers, track the development of those cavities and things over the course of multiple X-rays. But also it's kind of an imaging tool that we can really show patients, which has been one of the big things for us. So it's increased kind of patient education as a whole, where we can start to help patients understand what bone loss actually looks like, what a cavity might look like when it's sort of below a treatment threshold. And it's just a way that we can kind of increase a little bit of consistency in how that patient education is delivered in some cases. We're also utilizing a technology called Policy Map currently, where we have a 2-year contract with them that's also a grant-funded program. And it is a data imaging software. And one of the things that we really have been using that for is for mapping what our patient base looks like in terms of who's seeking care and demographic information about who's coming to Appletree for care in order to present to policymakers. So there are a number of projects that are going on with that, but those are kind of vital statistics that can go into meshing the needs in certain areas of medical and dental care. One of the other things that we have been just starting is a teledentistry platform called Mouthwash by Teledent, and Teledent by Mouthwash. So it's a platform for teledentistry, and basically it's a very user-friendly interface that allows providers to take screen captures, and it's something that can be done by anybody with a smartphone. So it's a way that we can, again, reduce some of those barriers to access, and then it's a secure file that can keep some of the information and imaging for the dentist to refer to in order to make proper recommendations. So that is something that definitely has a lot of promise for sort of integrating that care and collaborating with other kinds of providers. They do have an optional intraoral camera that could also be something that is useful in making referrals and then having virtual referrals to either between dental specialists or between dentists and medical specialists potentially as well. So things like that are certainly on the horizon, and the technology is being developed. And then after that, we just have to work on kind of how the relationships between the professional providers works in order to make that more feasible. And then another project that Nicole can actually speak to a little bit as well, if she'd like, is Grinscopes. So these are basically an intraoral imaging and recording device. So it's an attachment that can go onto the back of a smartphone camera, and they can be used by dental personnel to kind of scan teeth for virtual dentistry appointments, or their company also sends them to patients prior to things like telehealth exams. And mostly right now, they're advertising this for things like orthodontic care, as a way to get a provider more directly involved with some of those remote orthodontic programs, like Smile Direct Club, for example, things like that. But it also definitely has potential in terms of keeping that imaging in a high quality type of video and stills in order to be shared by different providers. So other ideas, we could have grin scopes with primary care providers so that then they can send that kind of data for remote screenings to get kids who are in need of dental care into dental offices. So things like that are certainly on the horizon and being developed technologically. So then it's just a question of developing those relationships, like I said. All right. So those are kind of some of the efforts that we've been working on in Fairmont, but definitely look forward to hearing questions from everybody kind of about what we have going on the local level, and even more than that, what Nancy and the Minnesota Oral Health Coalition have going on more on the regional and policy level too. So we can go ahead and kind of switch over to our Q&A time.
Sure. And I just wanted to chime in just for a few comments. As I mentioned, I'm a dental hygienist by trade as well. So I'm intimately involved with the work that Dr. Grantz is doing, and then some of very familiar with the work Nancy is too. So just a few comments that I had, and then we can go to the chat as well. For CHWs, I'm really excited to hear about the work that's underway, and I'll go to this because there's been a few comments in the chat too. But just working in clinic, I know how busy it can get in clinicians, dental assistants, dental hygienists, dentists, dental therapists. Sometimes there's not your book's so solid that there's not time to be really present with the patient to help understand how they're feeling, what they need, help them navigate the very crazy healthcare system that we have, especially when it comes to medical dental. Like say we have someone and they're hypertensive, and there needs to be that explanation about what does this mean, what are their next steps. And so I just feel like that will be a really great role for a CHW to be able to step in, and the clinician can provide care and obviously some education as they currently do, but then to have another role to follow up and, like I said, be present with the patient and not feel rushed. I know I often feel rushed at the medical appointments. I'm sure most of the people on the call can relate to that, whether it be medical or dental, because it's just the business these days and it's very busy. So anyway, I'm excited to hear about that. I did not know of that partnership previously. And then I wanted to chime in too about the collaborative practice dental hygiene. So for those of you that aren't very familiar with collaborative practice dental hygiene, in the state of Minnesota, dental hygienists can practice independently outside of a brick and mortar setting. And especially when we're talking about access to care among the Medicaid population, that's a really great way to reduce barriers. So for example, I've had the blessing to be able to go provide services to Head Start kiddos in Mankato multiple times. And it's great because the kids, many of them, they're 4 or 5, and it's their very first dental visit. And yes, we want kids to go to the dentist at age 1 so that they get comfortable with the environment and the experience. But in the real world, that just doesn't happen. Parents are busy. They don't know kids are supposed to go to the dentist. They don't have the means to do it. So that's why collaborative practice is really important, because it meets people where they're at, and it also increases access to care. So traditionally, dental hygiene has been very much a brick and mortar work under the dentist model. And I'm hoping that we can bring more opportunities so that hygienists know about just different ways to practice. So Nancy, that toolkit is wonderful. And just wanted to highlight too, because one thing that I've put together through my experiences lately is when we think medical dental integration, it doesn't have to just be connecting a dental clinic and a medical clinic. in my opinion, medical dental integration is when a dental clinician, like I just mentioned, is practicing and delivering services at Head Start or at a school, or like Dr. Grantz mentioned, we have multiple projects where we're delivering services at a long-term care facility because the residents have a really difficult time getting to the dentist. So that's where touching on that, and then the grin scopes, just to piggyback on that project, like Dr. Grantz had said, it's just a really cool technology, and patients really like it. It leads to a beautiful scan, so hygienists can go out in the field, or other auxiliary personnel and do an intraoral scan. Patients like to see it, and that image gets sent back to the dentist. It's called asynchronous teledentistry, and the dentist can do an exam remotely. And so I think those, oh, and the other thing I just wanted to mention too, just putting those together from Dr. Grantz and Nancy's presentation was, Dr. Grantz had touched on the mouth guard athletic screening event. This was also a really great opportunity. I have 2 boys that play sports myself, so it's just, there's a really big need for parents to understand how important mouth guards are. So it was a cool experience to be able to have the athletic screenings done by Mayo and the mouth guards done by us in the same setting. And Nancy's page has, from Meet Your Mouth, has like a brochure, a flyer about why it's important to use athletic mouth guards. So just a pitch for that website is really great. And I've personally used it when I'm trying to promote education to someone about an oral health need. Because they're pretty straight into the point. So people are like, oh my gosh, this is 10 pages and very overwhelming. So if you're looking for resources or tools for people that you serve, or just someone to get up to speed, or even yourself on an oral health topic, it's a great resource for you. So with that, see if anyone has a remark or a comment that they want to voice.
And I just want to say thanks for those comments, Nicole, because I did want to, I thought I was remiss in not talking about what collaborative dental hygiene practice was. So thank you.
Yeah. I think that us in our own head, and we just assume that everybody knows what this means. And so sometimes it's nice to be able to put it into examples of what it looks like in real life. So one thing that I'll bring up the chat, because I was excited about just talking about the CHW opportunities. So Rachel, you had made a few comments that you are currently working with a HRSA grant to promote CHWs. So it sounded like, Nancy, from your presentation, that I think it's community dental care is working with CHWs, but is that right?
Children's dental services.
Oh, children's dental services. Sorry.
Okay.
So there's a few big groups like Apple Tree, Children's Dental Services, Community Dental Care that all are working to serve a similar population. So Rachel, I think that the contact information from Nancy was put into the chat. And then certainly feel free, I'll put my contact information in there as well. If you ever have questions in terms of how this could work in practice, etc., feel free to reach out. And then Rachel, I had also seen a comment regarding that you'd like to discuss barriers to care. Did you want to discuss that here, like as part of a group, or were you wanting to discuss that separately with Nancy, like via a private conversation?
Yeah, thank you. I saw it just after I submitted my comment. I remembered that I think, Nancy, you're presenting to the Community Health Workers Circle on Wednesday. So that connection's already been made. I had gotten that flyer, but didn't notice that. So I'm excited. I'll try to attend that as well. Like I said in the chat, we have a HRSA grant to support people to get their community health workers certificates, and the Department of Labor and Industry has launched an apprenticeship program for CHWs in the state of Minnesota. And our first apprentice is actually employed at Ready, Set, Smile, which as a dental setting. And so we would love to support other dental settings and becoming registered apprenticeship sites with the state of Minnesota. And I'll stick my email in the chat if folks want to connect on that. That would be really exciting. We would love to see CHWs everywhere. Nancy, did you want to chime in?
Yeah, that was something that I was I was going to make a brief comment on that too, that yeah, Ready Set Smile is a nonprofit that deals with dental education in schools as well as dental screenings, and sort of an effort to match some of those young students with a dental home. So that's something where the education piece is mostly done by those community health workers. And that's a type of model that I would love to see expanded and repeated for both oral health education, nutrition, kind of other collaborative crossovers between in sort of thinking about oral health as systemic health. So that's something that I'm actually hoping to work in tandem with Ready Set Smile as part of a practicum experience for my master's in public health over the course of this summer. So I'll be finding out a little bit more about that and how they utilize community health workers in that model, and sort of how they also work to track the dental homes and the dental care received by their students after the screenings. So that's something that I'll be doing a little bit more of as we move on.
And I just had one other thing to ask you guys about. When I currently do administrative work, but I am a CHW certificate holder. And when I was doing community health worker field work I live outside Winona, Minnesota, it was almost impossible to get Medicare, Medicaid recipients connected with dental care because there are zero, when I was doing the work, which was 2 years ago, there was zero dentists in Winona County who accept either Medicare or Medicaid. And so even if someone has full health coverage, they can't access dental coverage. And transportation is also an issue. We're so thankful to Appletree in Rochester because they do accept Medicaid. But if you are late or miss your appointment, you get bumped sometimes. So, and I know that, Appletree needs to do that. And it's just this bad, people who have barriers to care also have transportation barriers, and that can make them miss appointments. So I'm wondering from a policy perspective, if anybody is looking at that. And, I know that Medicaid pays less, but it's really tough for folks if they're just going to the emergency room over and over and over again to get antibiotics, but can't get to a dentist.
Go ahead, Nancy.
I was just going to say that maybe, Rachel, maybe I could connect you with Northern Dental Access Center, because they have a model for seeing their patients, and just a little bit different scheduling model, taking into account that one of the barriers to care is transportation. So just offline, I'm happy to talk to you about that.
And Rachel, it's just a tough environment. I worked in Medicaid and Medicare for over 10 years now, and there is access to care issues, and there's the state is very much aware of it. So is the federal government. There's been a lot of initiatives and policy-wise to increase access to care. There's been an increase in reimbursement rates a few years ago. This year, effective 1/1/24, they increased the benefit set. So there was a limited benefit set for adults that now is comprehensive. So it's the same as it was for pregnant women and children. So there have been little moves like that made. But as you know, like Appletree, we have 9 centers across the state of Minnesota, and we have waiting lists at every center because there's just not enough dentists to serve all the people that need to be served. So it's unfortunate, and especially southern, I will say just from my own personal experience, what I've seen is southern Minnesota, Winona, Mankato area, and then Duluth, Hibbing up north and south has just been very difficult. So I know that some health plans offer care coordination services. Like for example, Delta Dental, I believe that they have a care coordination service where depending on the health plan the patient's on, they can call and ask someone to help them schedule their dental appointment. But as you know, I'm not going to pretend that it's a perfect world and that there's lots of critical access providers. I'll just say that what I would use as a resource is if the payer, the health plan has a care coordination benefit for dental, make sure to use it. That does help. Because oftentimes those individuals know who's actually accepting patients, because what from serving and working with members is such a bummer is when they get a list of 30 people to call and they spend all that time doing it and no one's actually accepting patients. So I'd say use that as a resource. You just ask the health plan what resources they have for scheduling. And then from a policy standpoint, know that yes, the state and the government, the federal government, CMS, they're very aware of the access issues. There's continuous efforts to try to
Mhm.
improve it. There's been, like I said, critical access. So higher reimbursement for those that are serving individuals on Medicaid, increase in reimbursement rates. Now there's been an increase in the benefit set. And I believe the next area is to promote, there's a lot of policy efforts around promoting the support of critical access providers so that they can expand to help meet the needs that there
Mhm.
currently are. Dr. Grantz, Nancy, I don't know if you have anything
No.
further on that.
That's great. I love that you added such really important information for us. Thank you.
I'm just going to take a peek here. Since I was talking, I wasn't looking at the chat.
Yeah.
So
I think-
I will put email addresses in the chat so that, and I'll make sure that everybody has those. I'm just looking here. Katrina, I was just thinking, is it, okay, I think you were asking for Rachel's email address. I think so. Okay, and Nancy, you have yours there too, so that we should
yeah.
be good to go. Great. So we'll just make sure that that is up to speed. And I just ask, I know that we are at 12:57. Are there any additional questions or comments today? All right.
I want to thank MPHA for taking up the cause. Thank you so much for your series on oral health.
Very much appreciated. And thank you, Dr. Grantz and Nancy, for taking your
Yeah.
time to present
Thanks,
today
Nicole.
and to help everyone, just to promote awareness of medical dental
Yeah.
integration, the importance in what we're doing in this space. So thank you
Thank-
all. Have a great rest of your Monday, and we'll talk with
Thanks,
you later.
everybody.
Thank you.
Bye. Thanks.